but it's a lot like solving a mystery. You have to become a bit of a detective as a physician who's diagnosing people with MS because you're putting all the pieces together. So the first symptoms of multiple sclerosis can be almost anything, and this can be one of the most frustrating things about diagnosing multiple sclerosis, because it could be from a little bit of dizziness to a little bit of blurred vision, or a little bit of tingling somewhere in the body, or sometimes even severe fatigue or headaches. And so what's important is when somebody has a strong neurological symptom to look at what are their risk factors for multiple sclerosis and then doing the appropriate diagnostic tests. But it's a lot like solving a mystery. You have to become a bit of a detective as a physician who's diagnosing people with MS because you're putting all the pieces together and you finally have a full picture of, yes, this does fit all the criteria for multiple sclerosis. And when I was trained in neurology, I was trained in very specific courses that people have in multiple sclerosis, either a relapsing remitting course or a benign course, or more of a progressive course. But what I have found in the last decade of treating MS patients is that if we intervene early on and start making lifestyle changes for reducing inflammation, start making changes in terms of their stress level, you can very proactively change the course of this disease. And it's nothing that I was trained as a neurologist and something that I watched patients over a decade basically defy everything that I was taught about this disease. So what I tell my patients is, look, this is a very unpredictable condition, but there are things that we can do to just make you healthier. And if one of the byproducts is possibly changing the course of this disease, fantastic.